Hey guys, it's Sarah here. In this video, I'm going to be going over culture and sensitivity. So first of all, why is it done? So it's basically done to tell you which is the most effective antibiotics to treat whatever microorganism you have. Unfortunately, nowadays, antibiotics are being way too much overprescribed or just even inappropriate prescription, like given it for viruses, etc. And what happens is that because they're overused a lot, the microorganism develops resistance to it. So it doesn't help. You're giving it. The microorganism just keeps multiplying despite you having antibiotics. So this is why a sensitivity is done. It tells you, was resistance acquired to the antibiotics or is it a good choice? Now, how is it done? So basically, when you send out, let's just say, a strep throat culture. So you swab someone, you send it out to the lab. Then the lab, they take the bacteria, they put it on like a dish, and it's treated with multiple antibiotics at the same time. And if the microorganism keeps multiplying despite the antibiotics there, then it's resistant. It won't work. If it doesn't, then it's a good choice. So when you're working and you get a report, it's going to look like this over here. It's going to say an S, an R, or an I. Susceptible, resistance, or intermediate. And that's what you're going to see. So susceptible means that the medication stopped the bacteria from growing. So this is a good choice of antibiotics because they're effective. Resistance, which is the R, it means that the bacteria kept multiplying despite the antibiotics being there, so it's not a good choice of antibiotics. And I is intermediate, and intermediate basically means is that you need more antibiotics or even a higher dose or for a longer time in order to stop it from growing. So when you see this report, what you want to do is you want to make sure your patient's on antibiotics that is susceptible to, that the medication could stop the bacteria from growing. You don't want them to be on an antibiotic that is resistant to, because it's not going to help. The bacteria is going to keep growing because it developed resistance to the antibiotic. And if for some reason you can't prescribe susceptible, then you could go to intermediate. But the problem with intermediate is that you're going to have to go a higher dose or for a longer time in order for it to work. So with that always comes more adverse effects, etc. So always stick to your susceptible. Make sure they're on an appropriate antibiotic. Now, one more thing I want to point out. Now, in terms of the microorganism, so if you look over here, it says no growth and it says more than 100,000. So urine normally should be free of bacteria. It shouldn't have any bacteria. But sometimes it could get contaminated from even just inappropriate wiping before giving the sample. So if it's more than 100,000, then we say it's positive. If it's 10,000 to 100,000, then it's like indeterminate. And if it's less than 10,000, then we say negative for UTI. So, and see over here, the reference range over here, it says no growth. So that basically means is that what's normal is not to have any growth. Like I just said, it should be free of bacteria. So if yours is saying it's more than 100,000, then they definitely have a urinary tract infection. So I hope that explained it really clearly. And in general, please don't prescribe antibiotics if it's not absolutely necessary. We never prescribe antibiotics for viruses, and don't prescribe them if they're not necessary. And just make sure your patient is on the appropriate antibiotics whenever it is. So if you have any questions, please put in the comment section below and like and subscribe. Thank you.